Painkillers shouldn't be prescribed for chronic pain. We look into the new guidelines and what alternatives are available. A leading charity says more than a quarter of English councils are acting unlawfully by discriminating against children with autism. And finally, does the future lie in merging our bodies with medical tech? Well, all of that coming up today, and I'm delighted to say I'm joined by Orthopaedic Surgeon Andy Goldberg. Thank you very much for being with us today. Let's start with the news that the Education Secretary, Gavin Williamson, has said there is little evidence of coronavirus being transmitted in schools. But of course, it comes as plans are accelerated to reopen schools to all pupils in England next month. And the Prime Minister described face-to-face education as the national priority. Let's take a listen.
Yes, I do believe that getting our children back into school on the 1st of September, on the 11th of August they're going back in Scotland. I think that's a good thing. That should be a national priority. That should be something that we aim to deliver. It's the right thing for children. They can be educated in a safe and a COVID secure way. We should be getting them back into school.
Well, the current plan is for most children across the country to be back in the classroom by next month, with separate plans for Wales, Northern Ireland and Scotland. And in Scotland, schools are due to return tomorrow. So, Andy, it's been a sort of political hot potato, hasn't it, since the start of coronavirus? Clearly very important for children to be back in the classroom as soon as they can be, but still a lot of concerns for parents, teachers. What do you make of it?
Well, we're all now used to this new normal. At the end of the day, this is a global pandemic, and with any epidemic, there are very well-known public health measures that can be done to try and reduce the spread of the virus. Washing your hands, isolating once someone has the disease, stopping them from spreading it to someone else. And those measures are something that we're all having to do, whether you're working in a supermarket, whether you're working in an office, busy office, and schools are a very, 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 very important group that have to also find the ways in which they can achieve this national mission of getting kids back to school, which is an essential aim for all of us.
Absolutely. And you're parents to 3 children. How do you feel about them going back?
So it's really interesting. I talk to my kids all the time about it, and they're desperate to go back. They really miss the interaction with their friends and being part of school, and they're suffering, I think, from a mental health perspective of not being at school, and I think it's essential for them to go back. And I'm as keen as anyone for the kids to be able to go back in a safe, measured way, which I think is what everyone's objective should be. Absolutely.
I think what your kids are saying is echoed for quite a lot of children and families that I've spoken to. The Children's Commissioner for England, Anne Longfield, has called for regular coronavirus testing in schools. Do you think that's something that's sort of practical, but also that would allay the fears of a lot of parents, teachers and kids who are feeling unsafe about it? Yeah, so I think that the tried and tested methods are testing and testing and testing. The World Health Organization stated that right at the beginning of the pandemic. And then track and trace. As soon as you identify someone, that you trace who they've been with and isolate them. Testing, the challenge with it is we don't have a test that's instantaneous. In an ideal world, like you do with the temperature checks, you'd be able to test every kid as they come into the school, but there is no test that's that reliable and that accurate and that quick. And so we have to work within the framework of what actually we have at our disposal. Absolutely. Well, I think a lot of parents very keen to get kids back to school in the classroom as soon as they can. Well, when it comes to pain relief, many of us turn to simple over-the-counter medicines such as ibuprofen and paracetamol to manage daily aches and injuries.